Before we begin, cancer is a serious disease. The therapies that we're using are not yet approved by the FDA. Success with them is not guaranteed. The videos are of an educational nature and intent only. They don't establish your relationship between you and the clinic or you and myself as a provider. Please work with your own healthcare provider with your cancer journey. Thank you. Hello, I'm Dr. Mark Hancock. Today we're going to talk about IV vitamin C, which is a very popular add-on adjunctive therapy for cancer and sometimes is used on its own. I've seen it both help side effects as well as have an anti-cancer effect. And I'd like to start this one with a slideshow. So IV vitamin C, what is the rationale for treatment? Usually the treatments that we want to do 2 to 3 times per week. And often I like to use a 6-week induction period because 6 weeks is often long enough to know that something it has had a chance to work. And it's also long enough to assess. You can do tumor markers before, tumor markers after, a scan before or scan after, or sometimes physical findings. In either case, I think that's very helpful because we want not to just throw things at the wall. We want to have a logical succession of therapies. Ideally, unless something's really worked strongly, I like to switch gears a little bit after each 6 weeks, maybe going to a different pattern, maybe weekly after that. It is possible to do a 2 or even a 4-week more intense regimen, and it's important to note that you can do subcutaneous mistletoe even during the infusions. It is true, vitamin C, if you look at it, and if you've ever experienced it, it has a cooling effect. Most people, not just because of the fluids that they're getting, but they just feel cooler. And even we know that the C-reactive protein that has to do with inflammation, that actually has been shown in studies to be lower with IV vitamin C. So that means we don't want to put IV vitamin C together with mistletoe. We can do it the same day. It's possible. Ideally, we would have the IV vitamin C in the morning and then have a break, maybe a lunch break, or have some ginger tea, do something warming, do a sauna potentially, and then do the IV mistletoe later that day. Or what we also do is if you're doing infusions every day, do mistletoe on Monday, IV vitamin C Tuesday, mistletoe on Wednesday, that sort of pattern. Vitamin C is a double-edged sword, and I think conventional oncology and research is just starting to accept this. It's something we've known in the integrative world for a long time. Normal physiologic concentrations of about 0.1 millimole, it's an antioxidant. That's what most people know it as. The concentration of vitamin C above 1 millimole generates a lot of intracellular hydrogen peroxide, and that has a preferential oxidative effect. And that's what we're going for, and that's what we ideally will generate, and that's what has an anti-cancer effect, if it's going to have one. So these little animals, so the goat and dogs have been researched. When they're under stress, they have the gene to make vitamin C. Vitamin C in them is technically not a vitamin because they can make it themselves. In a hamster guinea pig, they don't have the gene. They're a little like us humans in that sense. We don't have the gene to make vitamin C. So it is a vitamin for them. But if you look at when a dog or a goat is stressed, they can make 75 grams a day on their own. They don't have to go to an infusion clinic like a human because they have the cellular ability to generate this powerful therapy on their own. It's ascorbate, which is basically the main compound in vitamin C. It's considered one of the strongest reductants and scavenger of radicals. In high doses, it inhibits arachidonic acid, prostaglandins, and it decreases cell proliferation. It works on this nebulous intracellular matrix. I mean, this is what we know of as the microtumor environment. Ascorbate helps immunocompetence. So we know it helps the immune system. There's studies that supplementing oral vitamin C will reduce the length of the common cold. reduced angiogenesis. Angiogenesis is blood vessel growth. That's very important in cancers because they cannot grow without more blood vessels, and they trick the human body into making more blood vessels for them. And so the ascorbate has also been shown to stabilize p53. So it's its own p53 stabilizer. P53 is a powerful anti-tumor gene which can throw the kill switch. It can detect if mutations have occurred in the cell. And if enough have happened, it will kill the cell. So cancer really doesn't like p53. It will mutate it, it'll downregulate it. So if we can get it to work, we can get activity against cancer again. It's known as the guardian angel of the genome. What about safety? These considerations are very important, of course, for us, because I want to do no harm, especially when we're dealing with things that are still investigational, still off-label. I don't want to complicate somebody's life. I want to help them. And so I want to know what I am doing is going to at least not be harmful and hopefully be very helpful. There are studies showing IVC alone, and even with chemotherapy, have excellent safety profiles and very, very low rate of any side effects. Sometimes if it's bolused in, you can get weakness, perspiration, dizziness, nausea, the other sort of effects. But that's rare. If you do it typically we aim for about doing 25 grams per hour, maybe 33 grams per hour IV. That means a 75 gram or 100 is going to take a 3-hour period. So this is a study that looked at what is a lethal dose in rats. That was 12 grams per kilogram. That is a huge dose. Humans are 70 kilograms on average. So we're maybe giving about maybe 1.5 grams per kilogram to a human. So it's typically not the IV vitamin C part that is worrisome. It is usually the sodium part. So in vitamin C, because it's sodium ascorbate, there's about 111 milligrams of sodium for every 1 gram of vitamin C. And so for low doses, that's not a big deal. But for people that struggle with sodium and retention of fluid, that's usually kidney failure, renal failure, also any problem with the heart or liver can give swelling issues. Vitamin C it needs to be watched. And what I mean by that is we need to watch your weight carefully. We, of course, would potentially monitor the dosing of it. It's not absolutely contraindicated. The other part is that vitamin C goes through the Krebs cycle and makes oxalate. Now, in big studies, it has not been shown to give oxalate-related kidney stones. That risk doesn't seem to be there in the studies, but I do feel if someone already has kidney stones, we should at least do due diligence. And I do have a method to try to prevent those stones from forming, usually with bicarb. If you have a history of kidney stones, let us know. We need to know about that. And if you have any of these other things, let us know. We want to know about that too. But generally, IV vitamin C is very safe. G6PD is also an issue. So G6PD is a gene that codes for an enzyme that is an energy creating part of the cell. And it's the one that red blood cells are totally dependent on because they don't have the ability to shift gears. They don't have a nucleus. And IV vitamin C will decrease that for a while. And in people that have a deficiency of that gene, we will test for it. That's 100% required. If you already have the test, bring it in. It's a genetic thing. So if you're normal, you're normal, and we'll accept that. It's very rare to be abnormal. And usually the cutoff is around 25 grams or more is considered high dose. And you really shouldn't do high dose IVC if you have a G6PD abnormality, a deficiency. Again, that's very rare, but I have about 3-4 patients that have that. And we just take things off the table. We'd like to do them, but there's no way to do them safely. If you do G6PD deficient, if you are G6PD deficient and you do IV vitamin C, there's a risk that your red blood cells will become very fragile and lyse, and you could cause anemia and make someone sick. Vitamin C won't do that to normal people. This is a new trial. This is maybe one of the best trials that have been done. I can't say I'm surprised because I've seen results with IV vitamin C. I'm surprised it finally got done because over the last 100 years, vitamin C there's been a hesitancy to research it properly, it seems like. Either doses are given very low, so instead of 75 grams, which is more or less the typical ballpark dose, people might get 5 grams, or it might be orally dosed. And we'll see in the pharmacodynamics that's just not going to be sufficient in cancer to do much. So this was the first very well done study. It was a randomized controlled trial. It was phase 2 in stage 4 pancreatic cancer patients. They were getting chemotherapy at the same time. That's also important because there's a belief among oncologists that IV vitamin C cannot go together safely with chemotherapy because it's antioxidative. As we reviewed earlier, low dose is antioxidative. So I would say probably best to not take low dose around your chemotherapy if it's a cytotoxic chemo, but high dose will help the chemotherapy work better. And that is the theory. And that's what this study showed. These people who were treated 3 times per week, they had less side effects and they had double survival. They actually stopped this trial early. And there's basically 2 main reasons to stop a trial early. Either you are harming someone and it's very clear, or it is so clear you're helping someone that it's time to get the word out. And this was fortunately, it was the second reason. They were clearly helping the people getting the IVC. And so they didn't need to continue the trial because the data was so strong. So this is a very important trial, and oncologists will know about this, or they should know about it. Some of the oncologists I work with know about it. I actually was informed about it by an oncologist that is a colleague about a week after it came out. So here's another bigger trial. Now this is called a meta-analysis. So they look at 23 trials and they look sort of through the data. And this was, of course, this was 2018, several years before the recent trial came out. So it looks promising, it looks safe, and it's tolerated well. But we need randomized placebo-controlled trials, which we got. There's maybe, I'd say, 2 main strategies with vitamin C IV. The Reardon Clinic, they are maybe the masters of using vitamin C. They typically would do testing, and they will look at the infusions over time and try to titrate to a serum level of vitamin C, 350 to 400 or so, and keep that going for many, many weeks, maybe even longer. Now, the other one I would call a Jane McClelland approach. Maybe others have the same idea. And the idea is that the IVC can create oxidative stress and extinguish glutathione, and it's better to do it sequentially. So Monday, Tuesday, Wednesday, better than every Monday for a month. You'll get far more killing power from the IVC because if you downregulate glutathione in the cancer cell, which is already quite stressed, and you do it again and again, at some level, that cancer cell won't be able to survive. That's the idea. And so you might even add repurposed meds to try to really synchronize with this. And there's quite a few that are possible that we could go into that you should talk to us about. And other therapies, such as hyperbaric oxygen, synergize quite well with IV vitamin C. IV vitamin C is the backbone of ferroptosis. So even just doing IVC and artemisinin or artesunate, just Chinese wormwood, there's a synergy between those. So anything oxidative, ozone and IV vitamin C, those go together really well. You're oxygenating, you're oxidizing. Now, we don't want to over-oxidize anyone because you'll be exhausted. So sometimes if someone's been so treated, we might do a little low dose vitamin C because it will help. Often if there've been so many rounds of chemo, a strategy like this isn't as good at that time. Maybe good later. So we need to be careful of oxidative stress. Often ferritin will show that up, and there may be other markers like LDH. So iron activation, we talked a little bit about something called ferroptosis, and we'll have our own video on ferroptosis. But IV vitamin C followed by IV artemisinin will activate cancer cell iron and make it very reactive. And we often will use Indian long pepper which we carry in our shop from MCS Formulas. We like them a lot. A little plug to them. We personally, I don't recommend using iron. Usually there's a lot more, sometimes 2,000 times more iron in the cancer cell, depends on the study you look at, than in the rest of the cells in the human body. So that's why there's a sort of a filter effect where you're stressing cancer cells, but hopefully sparing the stress from regular cells. That's the idea. But IVC is very important. And this is the last slide, I believe. So this is a graph. This is the plasma of different doses so of vitamin C. You can see this blue line here. These are sort of normal folks that are getting 1 gram, 5 grams, 10 grams of vitamin C IV. You can see here you get 25, and then finally you get to 50. With 50, you start seeing levels 50, 75, 100. You're starting to see levels up into the oxidative range, around the 3 to 400. That's where we know it's working against cancer cells. And the same, this is in people that have cancer, and it's partly showing, well, there's a bit of a difference, but very similar pharmacodynamics, really. Usually people need some, I think 75 grams is around the sweet spot. I see some variation here with the 50 grams. Some people will reach targets at 25. So this isn't thousands of people, but it's general. And you'll see that for about 4 hours or so, you'll get a therapeutic window of that's going to be there. And you'll reach serum levels that are exactly what we want. The other thing I'd have to say is that we use, because there's a study that shows if you do blood sugar tests with a finger stick blood sugar monitor, so a regular diabetic monitor, the CGM, continuous glucose monitors, these don't work. And in fact, there's a risk of burning one out. So if you do a high dose IVC, your sugar will look like it's going up. The continuous monitors, they're looking at interstitial fluid and as it goes through the arm, not in the blood. So they're a little slow on the uptake and they're not as accurate. But essentially it's an artifact. So it's not really your blood sugar going up with vitamin C. I can tell you that absolutely. But the meter has the same chemical reaction. It's a enzymatic reaction that makes a little bit of electric charge. And that's the same whether it's glucose or vitamin C. We can use that to our advantage. You come in and you can take your finger stick blood sugar, and we will do this because it's cheap and it's relatively good and it's fast. And we'll do the infusion. And then at the very end of the infusion, right as we take it down, we want to take your blood sugar again. And then we subtract them because the assumption is when you first came in, it's all blood sugar and your blood sugar remains relatively stable. And so we will subtract out what the final one is, which should be blood sugar plus the vitamin C. And that means that we will get around a very good number that estimates the amount of vitamin C in your blood. So it's not unusual to see 500 or 600, and we might subtract 90 to 100 from that because that's the blood sugar when you walk in. And the caveat is if you are a diabetic that gives yourself insulin, you cannot trust your monitor. And so we need to talk about that specifically. You can't trust your monitor, I would say, for at least 4 hours. So you don't want to give yourself insulin if you have a high sugar level after IVC, because it's probably not finding your sugar. That's probably vitamin C plus sugar. And most of that number is vitamin C. Hope that's not too confusing. We're happy to run through that with you if it does come up. So we'll stop this share because that's done. I hope this video gives you some idea about how IV vitamin C can be done. And again, logistically, we would ideally either do it in a 6-week induction period where you do 2 to 3 times per week, or we might do 1 time per week over more weeks as more of a maintenance pattern. Many people really feel better after IV vitamin C, and hope that you do too. The other thing that can and needs to be watched is any weight fluctuations. So when you do IV vitamin C and when you do IVs in our clinic, we want to get your weight every day just to make sure that your weight isn't just climbing. That's rare, but if it happens, that means that you're not gaining fat, you're gaining water weight, and we need to take a look at that. I hope that this video has been very helpful to go over vitamin C and its use and its synergy with other things. Thank you very, very much.